Hello, and welcome to Your Health Matters. I'm your host, Dr. Peter Hogenkamp, and today on the program we're going to be discussing how to manage your anxiety. I have the great pleasure of welcoming Dr. Julie Foster today to the program to help me discuss anxiety. Julie is a friend of mine, fellow golfer, and fellow family physician, and I'm very excited to have her here. Welcome to the program, Julie.
Thank you for having me.
So I wanted to start off today's discussion by telling a story that happened to me when I was in residency. And when I was in residency with my wife at the time, she's still my wife, but we were just married and both doing residency. And we had these lectures to go to at lunch. And this particular lecture was about managing your anxiety. And I had been on call the night before, and I got there. The first thing we did was to eat lunch. So I ate two turkey sandwiches, because that's the only thing I ever ate during residency. And then they turned off the lights for the slideshow, and I immediately fell asleep. So after about a half an hour, he turns the lights back on, the guy that was doing the program, and he says, for those of you who fell asleep, and he looks right at me, he said, the best ways to manage your anxiety without medication are good sleep, good exercise, and good sex. And to which my wife replies loud enough for everyone to hear, Peter, go get yourself a treadmill. And I have followed that advice for all these years because, the whole medicine, practicing medicine, learning to practice medicine, it's anxiety provoking. And I have found exercise as a great tool kind of thing. But since I slept through that lecture, I said, okay, I have got to do a lecture on managing anxiety. And it's only been 25 years, but here we are. So I also think in this anxiety provoking and stress-filled world, I think we all have moments of suffering from anxiety. And so tell me, Julie, because we all get anxious from now and again, what's the difference between momentary kind of episodes of anxiety and having a true anxiety disorder?
Mm-hmm. I think having a true anxiety disorder is really difficult to control, and it affects your function, your quality of life, and like you said, we're all going to feel anxious from time to time, and a lot of times it's completely situationally appropriate, like right now, or on the golf course.
On the golf course for me, yeah.
But it's when it happens more days than not,
yes.
And over a 6-month or longer period.
Right. And when I'm talking to patients about it, I'm like, how is this affecting your life? I mean, is it affecting are you doing poorly at work because of it? Is it affecting your relationship with your boyfriend or girlfriend or your husband or wife? Is your quality of life in the tank? I think those are great questions kind of thing. So having said that, what are some of the symptoms that people who have a true anxiety disorder, what are some of the symptoms that they would have?
Mm-hmm. Nervousness, irritability, overthinking things and feeling insecure, not to mention the plethora of physical symptoms.
Right.
Again, feeling a little nervous about being here right now. I can feel my palms sweating,
yeah.
My heart's racing, and muscles are a little tight. Imagine feeling that way constantly.
24/7. Yeah.
Not good.
Yeah. And I remember a friend of mine, and he used to have the expression, he goes, I'm having a panic attack kind of thing, and he was using it as a joke kind of thing. But in reality, panic disorder is a big part of this as well. Mm-hmm. People who have such severe anxiety that they're having a panic attack, and they don't really realize they're having a panic attack. They think they're dying.
Absolutely. Mm-hmm. And sometimes those come on for no identifiable trigger. And that's especially frightening.
No identifiable trigger. And that's the thing that I talk about a lot with my patients, and that is, yeah, I mean, like for instance, someone who's depressed after their wife of 50 years dies. That's a kind of appropriate. Kind of.
Mm-hmm.
But or if you're anxious because you got bills to pay and there's not a lot of money coming in, or there's real reasons in your life that are anxiety provoking. Mm-hmm. I understand that. Mm-hmm. I do. But especially when somebody has really no reason to be anxious. They've got plenty of money, their job's going well, mm-hmm. and yet they're still having anxiety kind of thing.
Right.
Those are kind of difficult. Mm-hmm. So when we talk about anxiety, obviously, you know, as physicians, we want to encourage you to talk to your doctor about that kind of thing. But there are lots of ways to manage anxiety. So if I were a patient of mine and I just came to your office and I said, you know, listen, Julie, I'm getting anxious. It's becoming more of a problem. How would you start me out on a treatment path, you know, kind of with mild anxiety that's just beginning?
So, you know, you and I'm sure we're going to be talking more about some lifestyle modifications that people can make, which is absolutely key. But as far as things that I often do in my office, both recommendations to therapy and medications for mild to moderate anxiety can be equally effective. So a lot of it is figuring out the patient's comfort level and their individual choice, and of access to therapy.
Right, which is always a big.
It's a big one.
I know.
And so it's not. I don't have a routine of my first recommendation is X and my second is Y. It really requires a conversation and figuring out their individual situation.
So let's say your patient's a guy like me, and I like to look at things from a lifestyle modification standpoint first.
Yep.
And then kind of go down the road from there. So let's say I come in and I'm definitely having some anxiety. It's starting to interfere with my work. It's starting to interfere with my relationships. So how can I modify my lifestyle to lessen my anxiety?
Well, you already made the reference to sleep.
Right.
Which is huge. We really need to improve our sleep patterns to feel well rested and replenish ourselves. So many times when we don't feel like we're sleeping well, then we're tired during the day, and then we're amping up our caffeine.
Caffeine.
So we also have to talk.
Is caffeine not good for you?
I think in moderation.
Dang it. Yeah, so good sleep. And good sleep is one of those two-edged swords because, you know, I've had periods of my life where, you know, I haven't slept well. And then, you know, so then you're tired and you're getting more anxious and to get more sleep, but then you're not sleeping.
Yeah.
And the anxiety actually makes you not sleep well.
Exactly.
So that's kind of a tough one there.
It is a tough one. You know, and speaking of caffeine, that leads me to another thing that we drink, alcohol.
Alcohol. Yes.
Because we think it relaxes us.
We do.
And we have a couple cocktails at night to unwind. But guess what? Then our quality of sleep is not as good.
Not as good.
And then I'm blown away by how many people tell me they feel anxious the next day.
Right.
Do you hear that?
All the time. Yeah. And one of the things I always like to point out about alcohol is that, you know, alcohol has some kind of brief sedative properties, but alcohol is a CNS, a central nervous system stimulant.
Yes.
And so, you know, you have a couple cocktails, 2 hours later, the kind of sedative effect is worn off, and now your mind's wired, and you don't sleep as well. It's something that didn't happen to me when I was younger, but now that I've gotten a little older, I have noticed kind of thing, you know, that I don't sleep as well with that. The caffeine too, I really try to cut off the caffeine at noon.
Definitely.
That afternoon cup of coffee, which I love, can be problematic.
Yep.
So good sleep, and one of the we talked about also good exercise.
Absolutely.
So let's talk about exercise because I really do think it's there's a lot there in terms of management of anxiety. What do you tell your patients about exercise and anxiety?
You know, it's beneficial for so many reasons. Number one, it deviates you from life stressors. You're concentrating on something else for a limited amount of time that's just for you.
Right. Absolutely.
There's the chemistry behind it, endorphins.
The endorphins, the encalphins, and all those things that I knew in medical school that I've subsequently forgotten.
Yeah, we can just call them chemicals now.
We'll call them chemicals. No one's going to quiz me on it. Yeah, right. So those chemicals actually are similar to morphine, actually. And have a very relaxing effect on your brain kind of thing.
Absolutely. It
Anxiety
alters,
lessening.
improves brain chemistry. And then muscle tension.
Muscle tension, absolutely. Which is a big part of anxiety, which is a big part of the physical symptoms that people get with anxiety. Because like, for instance, I've had people, and I know you have chest pain with anxiety.
Yes.
And that's from that muscle tension that they're noticing.
And headaches.
And headaches. And the exercise really helps just the muscles, after the exercise, they tend to relax. Also, going back to the sleep argument, when you exercise more, you sleep better.
Yes.
When people are having difficulty sleeping, I always say, you know something? Go earn your sleep. You know, if you're lying on the couch all day, why do you need to sleep? But if you're outside, I was fortunate enough to spend a couple hours with my friend skiing this morning. It's fantastic. I'll sleep great tonight. So exercise helps the sleep. I also find it just helps me kind of put things in perspective. You go, especially for people who have physical symptoms for their anxiety, chest pain, they're concerned there's something wrong with them. And going out and exercising, you're living through it, all of a sudden you realize, wait a minute, I'm healthier than I thought. It's this perception of well-being that I think that exercise is great for. Is there any particular exercises that you recommend?
Yes, what people enjoy, because then they'll stick with it.
I knew you were going to tell me that.
Did you?
Yes, and I think it's a great point.
Some people, they want to be alone, just listening to music and in their own thoughts. I personally thrive with being in a group environment, and I've become good friends with the people I exercise with, and that's part of the stress reduction, is the social aspect.
The camaraderie of it all. And you like to do things like, you're in the gym working out with like classes and
classes,
stuff like,
like interval training classes and some weight classes. I personally don't do yoga, but it is so beneficial for so many people and so relaxing to them. So
I had that written down as a point to chat about. I've now done yoga 3 times. When my son is a big practitioner of yoga, and he comes home, I go with him, and absolutely fantastic, and way, way harder than I would have ever expected. I'm impressed by the conditioning and the shape of some of these people.
Absolutely.
And yoga has that nice kind of mind-body thing to it too. They openly talk about the whole mind-body link kind of thing, as opposed to like skiing, which we don't talk about that kind of thing. Right. So yoga, Pilates.
Yes.
I was also doing some research last night about this, and I was looking at things like Tai Chi, martial arts. There's a lot of things that are excellent and specifically looked at for exercise to help reduce your anxiety kind of thing. You made a great point earlier about do what you like to do so you'll keep doing it. How many people get a gym membership on January 1st? And then by March, they don't even remember where the gym is.
It's a 3-month cycle.
It's a 3-month cycle. Yeah, so I think doing something you like, and also the classes that you were talking about. You got your friends. Hey, where are you, Julie?
Yep.
Get your butt over here. We're doing, and I think that's excellent too.
Right. There's a degree of accountability, especially the early morning classes. You sign up at the night before, so when your alarm goes off, you're like, well. Yeah, I said I was going to be there. My name's on the screen.
On the list.
I got to go.
Oh, man.
And then once you're there, you're great.
You're great. But getting out of bed can be hard.
Getting started.
Right.
And that's the biggest point I tell people when they're not in an exercise program, that it's not going to happen on its own. You have to come up with a plan. You have to put it on the calendar. And at first, you kind of have to force it. But I assure you that in a short amount of time, you're going to feel so much better, and you're going to want to do it. And you're not forcing it. You want to get out there.
Yeah, there is that kind of steep part of the curve there where you just got to say, I got to do this.
Yes, that's exactly right.
So is there an intensity of exercise that kind of leads to the lessening of anxiety? Or, do you have to get to a certain heart rate, or is there a link there?
I'm not sure.
Right.
I think to get some of those chemicals we talked about, your endorphins, you probably want to get a pretty good workout.
Pretty good workout.
Get your heart rate up.
Yeah. I find that the harder I work out, the more relaxed I feel afterwards. All right, so exercise. We talked about sleep. I mentioned sex earlier.
Yeah. I don't have any comments on that.
That's a tricky one. We'll skip that one. But there are some things I wanted to talk about, like, for instance, mindfulness. I have looked a little bit into mindfulness. It seems to me like there's a lot of overlay between mindfulness and meditation, but I think that's okay. Mindfulness and meditation can be wonderful ways for people to relax, kind of thing. I have tried it a number of times, and I can really see that I think it's one of those things that you'll get better at it if you do it a lot.
Right.
But I think meditating could be a really good way of doing it.
I've heard that. I haven't personally done it, but I've definitely had patients and friends have some mindfulness apps on their phone or different programs that they've looked up.
Right.
So it is an option out there.
My daughter sent me a mindfulness app because they practiced it at her school, and it was wonderful. She and I did it together one time on a car ride kind of thing, and it was really, really kind of helpful. All right, so we've got yoga, we've got meditation. Let's talk about some of the more kind of traditional ways we treat anxiety, like counseling. I find, and I'm curious to how you feel about this. Do you feel like there's some resistance with patients in terms of going to counseling?
I do.
Yeah, yeah. And how do you overcome that?
Just trying to educate the benefits of it in terms of, if you learn some effective coping skills, those are going to stay with you.
Right.
Whereas the medication's only going to work as long as you're taking it.
As you're taking it.
The coping skills are going to last hopefully a lifetime.
So are they, a lot of my patients, will say something, well, I can just come in and talk to you, this is going well. And I'm like, well, I can't sit here for an hour and talk to you as much as I'd like to, kind of thing. But are they doing more than just kind of sitting there and talking to you and getting things off your chest?
Yes, I think there's definitely a lot more of training, relaxation techniques than, I have the skills to provide.
Right, absolutely. Right. For instance, not only do we not have the time, but we also don't have the training or skills to do that kind of thing. One of the things we were talking about before the program was just, access.
Yes.
Their anxiety is a very common problem, as are depression and a lot of other mental health illnesses. So getting people into counselors can be hard, actually, but so valuable.
Right. That just reminded me, I was at a conference on lifestyle medicine through Harvard, and that was their point, that we don't necessarily have the skills in training those, nor the amount of time that therapists spend with patients, but we can still make some effort there, and taught us like a 5 to 10 minute session on breathing techniques.
Really?
So I actually, and he said there was a tutorial online, so I looked it up, and anybody can look it up. Just type in through Google Harvard breathing relaxation techniques.
Nice.
And there's videos and training and a lot of really good feedback.
Nice. And that kind of ties in with that whole thing of, we were talking about with yoga and mindfulness, because all those disciplines, they do kind of teach people breathing techniques, and I think those are very valuable, because when people are anxious, they tend to breathe too fast. And that hyperventilation leads to all kinds of bad changes in body chemistry. That's right. So, who is at risk for anxiety?
I think people who have kind of a genetic predisposition, so family history of anxiety and depression.
So if those things are running in your family, your aunts and uncles and mom or dad or brothers and sisters, you may be really watch for it.
Traumatic experiences at any point in your life, and certainly mostly undesirable events in childhood.
Right. When I answer that question at work, I always tell people, if you have a brain, you are at risk for anxiety. And I think we all have anxiety from time to time. Again, going through this spectrum of anxiety, where some people who are not very anxious, but they'll occasionally have some anxiety, maybe about a specific situation, and then all the way over on the other end of the spectrum are some people who are literally crippled by their anxiety kind of thing. So let's talk about them for a little bit now, and get into the whole subject of pharmacy management of people with anxiety. So what is the general approach?
So those people who really feel limited by their symptoms, I really do encourage medication.
Absolutely.
And there's two categories that are kind of recommended first line. One is the serotonin reuptake inhibitors, and most people have heard of the
like Prozac,
Paxil, Zoloft are the three older ones, and then the two newer ones, Celexa, Lexapro. All in generic nowadays.
All in generic, yep.
And then the other category I'm referencing is the SNRIs, so they work through the serotonin, like that category, as well as the norepinephrine. So your brand names there are going to be Effexor and Cymbalta.
Venlafaxine, that kind of thing.
Yes.
Yeah. So so just kind of for a layperson, how do they work in managing your anxiety? Because they're different from like the older medicines that we used to use, like Valium and those ones. They work differently.
Absolutely. Some of those older ones are more hypnotic sedative type medications, and these don't. They affect the reuptake in your brain cells of the neurotransmitters that we already have.
That we already have.
These are a normal part of our body.
Right.
But by blocking the reuptake, it increases the levels. So by improving or raising your serotonin levels, you
Right.
can have improvement in not just anxiety, but depression symptoms.
Depression as well.
And, the medications that we just listed, basically first line for depression as well. And there's a lot
Right.
of overlap
Right.
with depression and anxiety. So it's often a 2-for-1.
Right, it is often a 2-for-1. And you ask people who are depressed, and oftentimes their symptoms are all anxiety. But people can be straight anxious, can't they, without
Absolutely.
depression?
Absolutely.
Yeah. So we were talking about the Prozac type drugs, and one of the things I like about these medications is, number one is they're not addictive.
Correct.
Right. For instance, when you talk about anxiety medications, I think people tend to think about back in the old days, they used to give people barbiturates and that kind of thing, like phenobarbital and stuff like that. Then Valium, which is also a very effective anti-anxiety medication, but addictive, or can be addictive
Right.
or habituating. But these serotonin agents, they're not addictive. They don't interfere with your ability to operate a motor vehicle.
Correct.
I mean, there's wonderful things to them. One of the things I find that some patients don't like about them is that they have to take them every day.
That's right.
So you're taking them every day, you're establishing a level, and it takes a little while for them to work as well. What about some of the quicker acting agents, like the benzodiazepines I was referring to, like Xanax or
Yep.
Valium kind of thing? How do you approach those in your practice?
I think there's definitely a role for them, especially if somebody's going through a grief or an isolated,
Right.
really difficult time.
Right.
That's appropriate. Or while you are getting them going on one of these other
Right.
ones, as you mentioned, they take time
They
to
take
become
some
effective.
time, yeah.
Or I prescribe them a lot for very specific situations. I would say probably the most common one would be airplane travel.
Airplane travel, right. So a plane phobia.
Yeah.
Yeah.
That's really common.
It is common. I know. So those medicines work right away.
Yeah.
For instance, if you give someone one of these benzodiazepines, within 5 or 10 minutes, they're noticing their anxiety symptoms are down. Do you discuss the whole thing about being careful about habituation and things like that?
Absolutely, because I explained to them if you take this regularly, you're going to get used to it, such
Right.
that if you don't take it,
Then
you get rebound symptoms. So
Right,
it's almost like
yeah.
your anxiety is worse, and you certainly don't want that.
You certainly don't want that, no. Yeah, and that always leads me to, when I talk about Valium and other benzodiazepines in the treatment of anxiety, I always talk about substance abuse at this point too, because how often do patients not wanting to go to the doctor or whatever try to manage their own anxiety, and how do they do it? By drinking, or maybe using street drugs kind of thing. And my comment on that is, when you're suffering from depression or anxiety kind of thing, you really want to be very, very careful about using any alcohol at all.
Absolutely.
I was always taught that alcohol is to celebrate something, not to numb something. And that celebration might just be a Wednesday night. We're celebrating Wednesday night. Woo! But if you're drinking because you had a long day at work, and that can be a slippery slope, or you're drinking because you're anxious and you're not sleeping. The next thing you know, in addition to your anxiety problem, you may also have a substance abuse problem as well. So are there any other types of treatments that you do besides the medications and the therapy?
Obviously we talked about some of the lifestyle changes that I
Right.
promote. There's also lifestyle issues that I recommend backing off of.
Such as?
In the younger folk, social media.
Oh, this is a great point. Yeah, I'm so glad you brought that up, because it was on my talking points and I forgot to mention it. Great point. Social media, just phones in general. The screen time in general.
Screen time in general, but I think specifically the things where you're looking at these glamorous pictures of things that other
Right.
people are doing and
Right.
you're not there,
Right.
or then waiting for the like on the picture of you. That's stressful to me, just thinking about it for
Yeah.
people.
You're absolutely right. And as I was doing my research last night, I did see there was a lot of work being done specifically about social media. So backing off from social media, which is probably fairly difficult. I mean, because for these kids, who are the teenagers, I have 4 children, and I see them involved with social media. It can be, it's almost be like withdrawing from, like a medication or something
Right.
like that.
But there's good things, on screens as
There
well.
are. There really are.
So
yeah.
I think, especially for parents, not taking the phone away, but limiting especially the social media aspect,
Right.
and talking to them about it and communicating about it.
Right. Just,
Putting it out on the table.
getting it off your chest. That's wonderful. And then you can combine a lot of these treatments as well. A person who is being medicated or on for instance, Prozac for their anxiety, that person can still be in counseling, can still go out and exercise, that kind of thing. So how prevalent are these problems in our society?
Greater than 5% of everybody right now, and over 30% in a lifetime, people are going to have significant anxiety.
So at this point in time, like 1 in 20 people is going to have significant anxiety.
Significant anxiety.
And in a lifetime, 1 in 30.
30%.
30%, or so basically about 1 in 3.
1 in 3, yeah.
And that's prevalent.
That's very prevalent.
That's very prevalent for sure. And is it on the increase, or is it about the same? I mean, I have this opinion, which is just my opinion as a layperson, that our fast-paced society is making anxiety disorders worse and making them more prevalent. I mean, what is your opinion on that?
I absolutely agree with you. I mentioned social media on one hand. The other point that I see in my office all the time that amazes me is I see a lot of retired people, and they literally spend their entire day with the news channel on.
Yep.
And, I'm not going to talk politics on your show, Peter.
Please not. I have a rule against it.
But it's very stressful for people.
Very stressful, yeah. And will you tell that to patients? Will you say, listen, turn that off. Turn it off.
Yeah. You can watch a little bit to know what's going on, and then
Right.
turn it off. Turn on some music,
Right.
or something funny,
Or go out for
read
a walk.
book.
Yeah, go out for a walk. All right, so we're kind of coming to the end of our program. So I just wanted to kind of summarize kind of thing. So if you're concerned that you might have an anxiety problem, you should be, the things to look for are, that you're having difficulty at your job, in your relationships, that these things are happening a lot.
And that you're not participating in enjoyable things that you think you should want to do.
Right.
You're staying away.
Right. In other words, like, you used to love to go skating, you're not doing that. You used to love to go to your book club, you're not doing that. For instance, all the things you used to take pleasure in, you're not going for whatever reason.
Correct.
Kind of thing. And so if you're at home and you realize that you have an anxiety problem, obviously you and I would probably encourage you, go see your doctor about it, kind of
Please.
thing. But let's say somebody wants to try it on their own, kind of thing. So then, as you point out, back off from social media, back off maybe from the alcohol and the caffeine, like we talked about, and then go out and exercise, get fresh air. I think all those things are worthwhile. And at what point in time do you say to a person, you really need to go to the doctor in regards to this? At what point in time would you say to somebody who's wondering about that?
I'd say if their overall happiness and quality of life is being impacted, then they deserve to feel better.
They deserve to feel better. Absolutely right.
And whatever it takes, we want to help them feel better.
And sometimes I think, those quality of life, decreases are so insidious that it's hard to actually figure that out. I always tell people that, listen, if your friends are telling you to go to the doctor, it's probably time to go to the doctor. Well, listen, thank you very much for today's program. One of the reasons I love doing this program is not only do I enjoy it very much, but I learn a lot from talking to my fellow practitioners. If you're new to the show, you can go on my website, peter@peterhogenkamp.com, and all the Your Health Matters on both the website as well as the podcast are there. Thank you very much for tuning in, and have a great day.